So I guess I'll start off before we really dive into certain things. I do want to talk about your past because we had obviously had a conversation a little bit, but I really want to dive into it because the reason why we're doing this video together is one is to celebrate your past, but also to share the journey that you had in taking this, because you had a journey that most probably have experienced and or will experience. So you've used programs in the past. You've attempted this how many times now?
So this was my third attempt.
Third attempt. So
Mhm.
we've clearly we've used other things in the past. What was your journey like? How about that? I'm not gonna.
Yeah, no,
I
that's
just want to hear like what you have to say, so students can really grasp what it's
yeah,
like to go through it multiple times and or what to expect.
yeah. So in a nutshell, I'm just going to highlight it was a struggle. Again, to the students, it's you're not alone. I actually graduated 2015,
Okay.
and I took the boards. I took the boards. This is like 4 months right when I graduated because I wanted to get it over with, and it was a complete bomb. The first time it was the old
Hmm. Right. The tradition.
boards,
Yeah.
which
With
is
the traditional. That was at
265,
265. Yeah. 265 questions. Yeah.
265 questions, and we had like allotted 6 hours.
Hmm.
I think I was out at like I think it was like 2.5 hours, but I finished at 75. So the first one, was a complete bomb. I didn't know any of the questions. They were tough questions, but I don't remember exactly. But I know that the first one was a bomb. So I kept studying, and then I took it the second time. That was 2000. Boy, I can't remember. This was a few years ago,
Okay.
like just under 3 years ago. So that was a while back, and I almost gave up. My wife was very, very supportive, and it was just a grueling, grueling path. Um,
It's
it
tough.
was
It's tough
it
when you've
it
got well, a couple of things. When you've been out of school, which you and
yeah,
I both have experienced. We both were out of school for a long time.
yeah,
Experiencing failure also, just it brings us down. You question your path. And when you've got a family to support and or you've got family that's expecting for you to take it to that next level, it becomes hard on us individually.
yeah. It was ravaging. Yeah, exactly what you're saying, Dr. Zien. It was just ravaging to my confidence level went down, and my wife was my, I got to tell you, she was my, a lack of a better word, just um, knight of charming armor. Like she was my left man, left hand man. I can't even think about it. Yeah, left
Right,
hand
right.
man,
Your rock. She was your
my
rock.
rock. And she never gave up on me. I gave up on myself, and it was just frustrating going to work and then just everything, responsibility, the house, everything. And so gratefully, I have to just I'm going to mention my dear friend who graduated with me. Her name is Paramit, and if she hears this, I can't thank her enough. Also, I mean, my wife is my rock. I can't thank her so much. It's just I can't thank her enough. And Paramit for introducing this program to me. If it weren't for her, I don't know if it was possible that I would have even learned about
NCLEX High
um,
Yield.
NCLEX High Yield. And I
Yeah.
have to tell you, this took me over the top. And just
So
keep, you stressing it to just keep everything simple.
right.
The monthly calendar, your um, your tips, your hot tip, your NCLEX high tip, tips book.
Right. The quick tips, yeah.
The quick tips did actually wonders, and just the way just the way you articulated, and you kept the teaching very enhanced and simple, and you taught us like doctors. I mean, the way I
Right.
received it.
Yeah, no, 100%, because I don't see a difference between, and I say this all the time. I think nurses are the backbone, the pillars of the medical community, period. But that
Yeah,
doesn't take away from a medical assistant, from a PN, RN, a PA, a DO, MD. we're all in the field to help people, and that's what it comes down to. And if we know everything all together and we don't differentiate and hierarchy, then
Yeah.
we're doing our ultimate goal, which is to help people and save our patients' lives or to get them better. But now from 2015, now I'm going to talk about
Yeah. No,
certain
absolutely.
things from 2015 to present before you got to NCLEX High Yield. How much did you spend? What did you spend it on? What did you think was beneficial? What did you think helped you take it to that next level? And then what about NCLEX High Yield differentiated where you were at and then took you to that next level of passing?
No, that's a really good question, and I'm gonna be specific, but get right to the heart of the matter. Is yeah, great question. So I used Kaplan, for the longest time. I can't even remember specifically. I mean, we had the Kaplan program and the ATI program throughout, my RN nursing school.
Hmm.
So I was using that consistently. Scores were up and down. They were not really consistent because I guess I was kind of complacent. So using Kaplan, the Q banks, and everything like that, trying to follow the structure. Um, I used Hearst as well throughout the program from 2015. This is all from 2015 up until around, just recently, a few months ago, 4 or 5 months ago, since March.
Yeah, since you were with us in March, right?
Yeah. So it was Kaplan, it was Hearst. I used the NCSBN. I'm not sure if that exists, Dr.
They
Z.
don't have it. I used to actually really like, and not to say anything negative about these programs because these are all great
Yeah,
programs.
yeah,
It just wasn't your cup of tea,
yeah,
because those are, I mean, they're phenomenal programs. It didn't work for you, but it works for a lot of other people. But NCSBN, I used to love those assessments. Those assessments were like my favorite assessments because they were so concrete in whether you were going to pass or not. But yeah,
yeah,
since the next gen, they haven't been around, but there's other ones that are out there. So you shifted. It's kind of like that saying, the definition of madness is doing the same thing over and over again, expecting a different result, right?
yeah,
It's what I did. That's why I kept failing, and then I had to change and shift focus. I had to go find a program that worked for me. You ended up finding us as your program that worked for you. And at that point, now you're in debt from school. You've
yeah,
spent, 7 years, 8 years, arguably,
yeah. About
to
8 years to
eight
finally get
years.
the success.
Now, Nurse Vincent. Now, I'm not saying this to make you feel bad because,
No, no, not at
but
all.
it's a reality. 8 years for those students that are listening to this, that are watching this. When you get to a year out, even 2 years out, in your situation, it was 8 years.
Yeah,
Let's do the math. On the low end, if you were to make 70,000 in 8 years, that's over $500,000.
right, right.
On the high end, if you're making 120, that's $1 million gone. So you see, like, I try to tell students, you don't realize it in the moment that 400, $500 in whatever program you spent it on that makes you pass, you're making that back. And now you're about to start making that income. But I did the same thing. I
Yeah,
waited 6, 7 years until I passed. And I was like, how much income did I lose? And like when I talk about the low end being 70 and the
yeah,
high end being maybe even more than 120, you're talking about $500,000 to $1 million.
yeah.
Like
It's
that's
crazy.
that's pretty that's a tough pill to swallow. But you're
Yeah.
here now. So now it's making it. Now it's
Oh my
your now
gosh.
you're making money.
Yeah. It's insane. I can't even fathom to tell you, actually, Dr. Z, and the students listening, the RNs to be actually listening. It's I'm still in shock. It was only a month and a half ago that I passed, and I just have to tell you, it's being consistent. What I did that was effective this time. I mean, NCLEX High Yield is, hands down the program that worked for me. I've tried everything up that I can just tell you. I listed those few. I think there were even a couple more, which is relative. It doesn't even matter. But NCLEX High Yield did it was the game changer for me. I mean, from the monthly calendar that Nurse Megan, Nurse
Brittany,
Brittany, a
yeah.
bunch of them, Nurse Justin had mentioned, work on that monthly calendar. It kept me with accountability. And my wife is just beating me up. She said to me, "Oh my God, Vince!" Like even on our road trip, she said to me, on our road trips with the family, she said, "Vince, did you need to go on demand with your doctor friend?" So I was like, because you know what, I could shut everything down. I could listen and put on the iPod, just the earpods on, and I could block everything out, and you could just focus on while you're driving and on the road and listen to the NCLEX High Yield on demand. And I have to tell you, that just did wonders. If I wasn't doing questions, it was every day. I was on demand, either at the gym, doing road trips, even if it was a 30-minute road trip somewhere. I just listened to, like, just out of the blue. Okay, you know what? I'm going to listen to cardiac or
Right.
GI. But I went down the list that you had on the lack of a better word, it was the content.
Yeah.
Your schedule, and I have to tell you, I put that also on the calendar.
Yeah.
Was just
Yeah.
everything you had in order from the highest topic
High yield tell, yeah. That's and
all the
I
way
do
down
that.
to the very, very bottom. I think that was it. I can't remember. Was it not basic care and comfort, but it was one of those last ones.
Well, yeah, I put them in order of what I feel is high yield to lowest yield. So that way, even people that are, you know, they're struggling for time or they've got a minimal amount of time, you start with the organization that I've provided you, and you don't have to jump all over the place, right? That's the last thing I
Yeah,
want. I want you to
and
focus and hit it step by step.
that was the nicest thing right there, because you mapped it out. You kept it simple. It was laser focused, and I needed a structure that was um that was simple. Was in
Yeah,
depth but yet simple, and you kept it really simple. And I just needed something simple,
yeah.
and you.
You use the word that I use all the time because I say this, and this is talking about myself. In order for me to have passed my boards, I really needed structure, I
Mhm.
needed simplicity, and I needed to dumb things down for myself. And that's just, and that's not to say that the people that take, NCLEX High Yield they're not bright, because a lot of them are smarter than I am. More majority of them are smarter than I am. I just had to really take it and simplify things down, and that's what I've provided for you all. But now I want to get into another thing that we had talked about that I emphasize so much. And you are the most recent person, being, weeks removed, less than 2 months removed from your exam, that people don't realize. People get fixated on 85, people
Mhm.
get fixated on 150, right? They get fixated on the number of questions that they get, but you can pass and fail at 85, you can pass and fail at 150. But what I say is, every single question that you do, I want you to take it as if it was your last chance. Because what happened in your situation, Nurse Vince?
Oh my gosh, and you just nailed everything right there. And I was gonna piggyback from what you just said, because what I did extra, or so I lost time. I lost time. My computer shut off at 1:26, and I
And
was out.
you used all your time.
I used all my time at 5 hours.
So you used all 5 hours, and you only got to 127 questions.
Yeah, 126. Yeah.
So 126. So it
Uh-huh.
didn't shut off because you passed. It shut off because you ran out of time.
Because I ran out of time and I had no idea. I was like, I felt ravaged and just weak and beaten up after. I had no idea. I was like dumbfounded at the end.
Yeah, because you're like, wait a minute, I didn't even get an opportunity to finish
Yeah,
my test, and here it is, I'm out of time.
yeah.
But ultimately, what happened?
So it's interesting. I didn't even do the PVT. The what do they
Right, the
call it?
trick, yeah,
Yeah.
the trick.
I chose not to do that because, so I tested out of California, and
Mhm.
I guess it doesn't matter where you test. It's just California is my state, and I actually waited. I waited exactly a month, and I said
Oh
I'm just
wow.
gonna. So I ended up doing questions I was like, you know what, I'm not going to even do the PVT thing. So I waited 4 weeks and I got the pass in the mail, and it was I was just like, you know what, I just kept praying. I just kept praying to God, and I did questions just to keep myself, my
Ready to
anxiety
take it
level down.
again because you're so used to it. You get used
Yeah,
to, like, when you fail, it's almost innate for you to think that you're going to fail again. And that's the mentality that I like to change in our students. But I mean, you decided to wait, and
I
that month
decided to
wait was
wait,
quite brutal.
and it was brutal. But you know what? I distracted myself in a nutshell, Doctor Z. I distracted myself. I kept my family occupying myself. We did road trips. Go to the church, what this and that, and I just kept doing practice questions every day, even with my study group from NCLEX High Yield,
Right.
just to and oh my gosh, it was ravaging, but at the same time, I was able to pivot my thinking just to be productive in the event, preparing that, okay, you know what, if I was going to fail, it's not the end of the world. I could always take it again.
Right.
4 weeks later, Dr. Z, I got the big heavy package from the California State Board of Nursing, and I had the certificate in there, and I was like, wow. I
You must have been in disbelief.
I was I was dumbfounded. I was excited.
Yeah,
I was
it was
just,
a range of emotions.
oh my gosh. I was like completely flat effect, because when I opened it up in the mailbox, my wife came in and she saw that I was a flat effect, and she opened up the package and she was like, what do you have in your hand? And I just handed, but knowing already, because I opened it up and I saw the pass and I was like, yes. But then I wanted her to see it. So I kept the flat effect. She goes, what's wrong with you? She goes, what happened? So I gave her the flat effect, like this guy, like the schizophrenic. So I gave her, she goes, what happened? She goes, let me see what's your hand. So she opened that up. She goes, oh my God, you passed. So I just looked at her with her. She goes, what's wrong? And then I just jumped on her and I just hugged her.
And what a feeling for somebody that was your rock, to go through an 8-year journey. I mean, that's quite the journey right there. 8 years, in order to get that pass. But I mean, the takeaway that I really want students to have from this, Nurse Vincent, is that I know times are tough, times were tough, times have been tough, and it's hard when you're out of school and you've already spent and invested so much money into your degree. But ultimately, let's just say it's 45 days, right? Let's not even think years. Every 45 days, we're still talking about four, five, six, $7,000
Yeah,
of income that's gone. And again, I'm gonna emphasize, we're not saying spend it on NCLEX High Yield, but I'm saying invest in yourself. Because if you don't get that pass, if you don't get that license, all that hard work, all that debt, none of it's not going anywhere. It's
yeah.
not doing anything for you because you're still waiting for that license. And whether it be whatever program, and a Q bank, right? You had said you used just one
Uh,
Q bank.
yeah, it was the one Q Bank, Doctor Z. It was boot camp.
Boot camp, yeah. So whether it be UWorld, Archer, boot camp, whichever Q bank you decide, I say this all the time. I don't care how you ask me about heart failure. Okay. It could be a UWorld question. It could be a board question. It could be a personal question. It could be an Archer or a boot camp question. It could be vague. It could be specific. It could be select all that apply. It could be a prioritization. I don't care how you ask me about heart failure, because if I know it, I'll be able to answer all of those. And that's how you prepare for the boards. And that's how I
Yeah,
prepared you. It doesn't
yeah.
make a difference how I built your stamina, because you were able to sit for 5 hours.
I was ready. I have to tell you, like when it was, so in a nutshell, I had the timer on, but then I knew I was going to be running out of time. So what I focused on was just the quality of the questions. So
You said the right word. Yeah.
you know, it,
Quality
it
over quantity.
and I
Quality over
remembered you. I
quantity.
remembered you
Yeah.
mentioned that to me. Like, and I know Nurse Brittany, Nurse Justin, they kept stressing that. Listen, focus on the quality and use the method. I have to tell you that Kingdom Come, the method, focus on the quality, because it's, and try to read as quickly as you can, but focus on deep breathing and do not worry about the time, because you know what? There are there are more people now than before that actually lose time on
Yeah,
their
that run out
phones,
of time. Yeah,
and they
because
still
case
pass.
studies and
They're
bow
still able
ties.
to manage to pass.
Yeah, and that's what I say all the time too. Case studies, bow ties, they do take a lot more reading because it's
Yeah,
not just a traditional question, and now they're
yeah,
becoming more and more of your exam. But it's about that quality. It's about actually getting the question right, and the more that we get right, does the time doesn't matter, but you must be able to sit for that 5 hour period.
yeah,
And again, that investment, like what is, yeah, I get 4, 5, 6, $700 is a lot of money. I
yeah,
understand that. That's groceries, that's rent, that's car payment, that's kids' food, whatever your obligation is.
yeah,
It's a lot. But if you don't make that sacrifice now, you're losing 6, 7,000, 6, 7,000, 6, 7,000 plus spending to take the test, plus your mental health deteriorates
yeah,
because it
yeah,
really does start taking a toll on you. Like, hey, am I meant to do this? Yes, you are. Yes, you are. 8 years later, you're still here and now you're licensed. Like, yes, you are. Like, everyone that's listening to this, everyone that's watching this, know that you've done the hardest step, which is passing that exam. I mean, passing school, getting that degree. Now what are you going to do about it? What are you going to do about it? And yeah, there are people, like, even when I was in my cohort, they passed
mhm,
in 6 weeks. It took me 12 months.
yeah,
There are, like, I had my own journey, but it made me who I am. It made you who you are. And look, in the grand scheme of things, the past is the past. You're here now, and now we've got to look forward to the future. And that's what it comes down to. Is, look, again, you ended up making the sacrifice, you ended up making the investment. And again, in whatever is your cup of tea, I ended up being Nurse Vincent, your cup of tea. And look at where we are. And the one thing I will say about Nurse Vincent is, for those of you that are listening or even thinking about taking the exam, Nurse Vincent, you always had your camera on. Always. I remember seeing your camera on all the time. All the time. You were at every lecture, you participated, you were answering, you were active. You weren't just sitting and not being proactive and active. You were I mean, you were sitting there, but you were being proactive. Sorry, you were being
mhm,
proactive. You're engaging yourself in the course and having your camera on. So even when I would see my students and I would see you with your camera on, and I would remember that. And and here we are. And like I said, you changed everything up to make this happen. And now, I mean, where are we at? What's our plans?
oh man, so oh my gosh, it's a great feeling. So a couple of things I want to just piggyback from what you were saying. It's the experience of being on, whether you're in person with Dr. Z and the NCLEX High Yield group, or online, the live on demand, or the live course, like virtual. It's it's still like the live experience. Just having your camera on, it helps you focus on being, present. The experience is just enhanced. I mean, speaking for myself, the experience was very, very enhanced. Interacting with you, interacting with Nurse Megan, Nurse Brittany, just the staff, whoever was presenting, but having you in the live course and then listening to you, piggybacking on your on demand was just wonders. And also your YouTube, it just helped so much. And then so the plans for me, I have, so my wife's cousin is helping me. She's lining me up with a government nurse job,
Oh,
a
wow.
government nursing job.
Amazing. Amazing. Great benefits, great pay.
Oh, it's yeah. I've been with the state for, I think, close to 14 years already. So, I was just recommended to just stay with the state, the government. So I'm just gonna piggyback and just continue on, but with a nursing job, working with the um, veterans and
Yeah, the
psychiatrics.
VA. Yeah, absolutely.
And the
Absolutely.
benefits are going to be awesome. But it's
But you have options. That's the best
so many
part.
different options. So
The world is your oyster, right?
oh
So
man, it's just a it's just this this stress and this heavy weight just lifted up. It's just a great feeling. I can't explain it. It's just yeah, I'm just forever grateful. I'm forever grateful for you. You know,
You can
my
breathe.
wife standing by me, my wife Rosalind, you know, you Dr. Z, just you know, your program really did wonders, and I can't thank you enough.
Amazing, amazing. No, that's again, like that's it's you look, you can breathe again, you can focus on family and friends and whatever your obligations are now, whatever your passions are now, you can focus on those. And at the end of the day, you've got the best feeling in the world knowing you have a paycheck coming. No matter
Oh,
where you are in the world, no matter what field you decide to go in, whether you like it or not, you have a paycheck coming. That's it. And that's the biggest takeaway is that you, no matter what, will have food on the table, will have a paycheck coming. And that's it.
stability is there. Oh my God,
That's it.
stability is just
Financial
everything. It's just, and
stability.
we're saving lives. You know, this is a noble
That's
career, and it's just I can't even. I mean, you're a healthcare provider. You can definitely you understand that.
100%.
It's a feeling of what is the word, Doctor Z? It's a feeling of not only you're getting an amazing paycheck, but you
Purpose.
know you're set for life.
Yeah.
You know you're set for life financially, and you're saving lives, and you're impacting the families of patients that you're going to be saving. And it's just it's a vocation that you know you have to have your heart in. And
Yeah.
it's not about the money, but it's you're impacting so many lives, and it's amazing. I can't wait.
Yeah. And here we are. Well, Nurse Vincent, I appreciate you reaching out and sharing again your amazing journey and just the words that you had to give to the students here to kind of to encourage them and kind of put things into perspective. I really do appreciate that.